Okay, so let's look at the second part of the topic on burns. So we're going to call it burns. Let's say part 2. Okay, we're going to call it like that. So here we're basically going to look at the severity. We also want to look at we are going to look at the clinical presentation, the pathophysiology, and management, and then lastly we're going to look at complications of burns. Okay, so now let's look at severity. Severity of burns. Now severity depends on, okay, it depends on these two. Depends on one, the depth, all right, the depth of burns. Now remember, in other words, it depends on the grades. Okay, the degrees. So remember, I looked at it. First degree burns, second degree burns, third degree burns, and fourth degree burns. Okay, so it depends on that, and then number two, it also depends on the surface area of surface area affected, the surface area of the body affected. So the deeper the burns, the more severe the burns are. The larger the surface area, the severe the burns. Okay, so that's how it is. So in terms of severity, we can have one what are called mild burns. Okay, so let me just allow in someone that has joined. Okay, so we have what are called mild burns. Now, mild burns usually they do not even require hospitalization. Okay, you do not usually need to admit a patient. Now, when we say mild burns, what does it mean? Okay, so we're talking about partial thickness burns. Okay, partial thickness. Partial thickness burns less than 15% in adults, okay, or less than 10% in children, right? So when you have partial thickness burns, okay, that are less than 15% in adults or less than 10% in children, or full thickness burns less than 2%, okay, then we qualify that as mild burns. Okay, we qualify that as mild burns. So we're saying that severity of burns, okay, severity of burns depends on the depth of the burns, where we're looking at the degrees, and then also the surface area of the body that is affected. Okay, so the deeper the burns, the more the layers of the skin that are affected, the more severe the burns are. Again, on the other hand, the larger the surface area affected, okay, the more severe the burns are. Okay, so mild burns, this consists of partial thickness burns less than 15% in adults or less than 10% in children, or full thickness burns that are less than 2% in terms of surface area. Okay, then let's look at moderate burns. So moderate burns, when you look at moderate burns, okay, number two, so moderate burns, here we're looking at partial thickness burns, okay, partial thickness burns less than, between 15 and 25%, okay, in adults, or 10 to 20% in children, right, in children, okay, or if it is or third degree, or we can say full thickness, or full thickness which is third degree, right? Fourth thickness, which is between 2 to 20%. Okay, 2 to 20. I mean to 10%. Okay, so if you have partial thickness bends, either in children or adults, between 15 to 25% in adults or 10 to 20% in children, or full thickness bends between whose surface area is 2 to 10%. Okay, then we qualify that as moderate bends. Okay, then last we have the major or severe bends. Okay, so what are severe bends? Number three, severe bends. Okay, severe bends in this case now, this is where we're looking at partial thickness bends, okay, greater than 25% in adults or greater than 20% in children, all right, or full thickness, okay, greater than 10%, okay, full thickness bends greater than 10%. Then we also look at all electrical and what chemical bends, especially if they are deep. Okay, chemical bends, especially if they are deep, and chemical bends. Okay, and then we also look at all bends in special areas. Okay, in special areas. That is, for example, if you look at inhalation bends, okay, inhalation. So, for example, someone inhales a toxic substance, or maybe they drink an acid, okay, and then also in things like in the palms, in the feet, okay, in the perineum, okay, in the perineum, right? All those, okay, all those are going to things like the ears and the eyes. Excuse me. So all those special areas, if they are involved in the bends, then we qualify that as what? As severe bends, and the patient needs admission. You need to admit the patient. Okay. So these two, the moderate and the severe, those are indications of hospitalization. I think we're going to talk about that a little later. Okay, so let's look at the clinical features. Now, clinical features of burns, it really depends on the degree of the burns. Okay, it depends on the degree of the burns, and that's what we're going to concentrate on. Is there any problem, any question, or any addition? Okay, so let's look at clinical features. Right. So we're going to look at this in depending on the degree. So let's look at it. First degree. First degree burns. Okay. Now, what you're going to see with first degree burns is number one, you're going to see erythematous skin. Okay. In other words, red skin. So the skin is going to be looking red. Okay. And other than that, there's going to be pain on the burn site. All right. There's going to be pain on what? On the burn site, or at the burn site. All right. Then, other than pain, the other thing that you're going to see, what you should notice is that these first degree burns, they only involve the epidermis. Okay, only involves the epidermis. So it's only the epidermis that is affected in the case of what? These first degree burns. Okay, then in most cases, or rather in this case, you're going to find an intact, okay, intact epidermal, okay, dermal junction. All right. So remember, there is that junction between the epidermis and the dermis, isn't it? So that junction is going to be intact in the case of first degree burns. Okay. Now, the other thing that we should know about first degree burns is that there is no scarring. Okay. So after the burn heals, you're not going to find any scar. Okay. There's not going to be any scar. The other, now let's look at an example. Okay, so we can look at an example of sunburns. Okay, sunburns, or we can also look at minor scald burns. Okay, for example, if you are, let's say, boiling water in a pot or in a kettle or whatever, and then without knowing that it has boiled a lot, okay, it's very hot, then you open the lid, okay, then that steam comes into contact with your skin, you're going to get burnt, and those are called the scald burns. Okay, so scald burns, it's as a result of vapor, hot vapor. Now, in most cases, all you're going to have is what are called first degree burns. Okay, and those are the characteristics of these type of burns. So when a patient comes and then you inspect the patient, you take your history, you find that they have these characteristics. Just know that this is a first degree burns, and you do not need to admit the patient. In most cases, actually, these patients are not even going to come to the hospital because these burns, patients will not see much need to come to the hospital. However, if they come and you see these characteristics, then you should know that these are first degree burns. Okay, so let's look at superficial second degree burns. Is there any question before we proceed? Okay, so please, in case maybe you have questions, just take note of them, then you can ask me at the end after we're done with recording the video, so that we avoid lengthening the video unnecessarily. Okay, so let's look at superficial. So remember, second degree, we said we have superficial, partial thickness, okay, and we have what I call the partial thickness. Okay, so here it's only involving the epidermis, the epidermis plus the papillary dermis. Okay, then here this one is involving the epidermis, the papillary, or let's just say, and the dermis, the entire dermis. Okay, the entire dermis. So that's the difference between the superficial partial thickness and the partial thickness burns. Okay, this one is involving the epidermis and only the papillary dermis, which is the top layer of the dermis, and then the partial thickness ones, it's involving the epidermis and what, and the entire dermis. Okay, so now we're going to divide it into two. We're going to look at this into two. Okay, like that. So now, with the first one, what we find is that there is intense pain. Okay, there is a lot of pain. So these patients, they are going to complain of a lot of pain. I'm sure a good number of you have had these kinds of pains before. Okay, then we're going to find that there's going to be white to red skin. Okay, and then there's also formation of blisters. Right, there's also formation of blisters. So patients who come with second degree burns, they're going to have blisters. Other than that, so I've already mentioned that it involves the epidermis and the papillary dermis, okay? And then in this case, okay, it does not involve appendages. Okay, skin, it does not involve skin appendages. Now, what are skin appendages? We're talking about things like hair follicles, okay, hair follicles, and sweat glands. So the sweat glands and the hair follicles, they are spared. And actually, when we look at epithelialization, because these kinds of burns, they heal by epithelialization. Okay, so epithelialization is going to start from the hair follicles and the sweat gland. So imagine if this is, let me use black. If this is a hair follicle, all right, like that, and then um, skin is like that, and then it has been damaged like that, but it has spared the hair follicle. So what we're going to find is that epithelialization is going to start from the hair follicle. It's going to start from there and start going in that direction. Okay, so that is what is going to happen in the case of these superficial partial thickness burns. So epithelialization starts from the appendages, such as the hair follicles, and then it spreads like that. Okay, then so we've already said that it is very painful. The other thing is that it is also very sensitive. Okay, it's very sensitive, such that even when you touch the area, you're going to feel a lot of pain. Okay, now because we're saying that it heals by epithelialization, okay, it heals by epithelialization, there is no or minimal scarring. Okay, so it heals by epithelialization. Then we're saying that there is no or minimal scarring. Okay, so not so much scars are going to be formed. Okay, not so much scars are going to be formed in this case. So there is spontaneous epithelialization. So the epithelium is going to regenerate itself. Okay, the epithelium is going to regenerate itself like that. So that is about these second degree superficial partial thickness burns. And this epithelialization, by the way, it occurs in about 7 to 14 days. Okay, it takes about 7 to 14 days for this epithelialization to occur. Now let's look at the partial thickness burns, the second degree partial thickness. Okay. Now this one, like I've mentioned, it involves the dermis, the epidermis, and the entire dermis. Other than that, the skin, or rather, it's going to appear pale. Okay, it will appear pale. All right, and then here it does not. It does not cause sort of pain on touch. Okay. Now, or we can say there's no change of color. Let me use that term. There's no change of color on touch. Because with the others, what will happen is that if you touch the area that has been burnt, you're going to find that the color is going to change. Okay, there's going to be some color change. All right, it will turn sort of whitish or something like that. But in this case, that does not happen. Okay, now here you find that the capillaries, are absent because they have been bent as well. They have been affected. Okay. Then, other than that, what we find is that these are less painful. They are less painful compared to the others that we've discussed so far. Okay. Then this will take about 14 to 35 days. Okay, 14 to 35 days to heal, or rather for epithelialization. Okay, so once you get bent, it's going to take up to a month. Now, in this case as well, this occurs from what? From the hair follicles. Okay, from the hair follicles and the sweat glands. That's where epithelialization is taking place. Now, in this case, what we find is that you can find severe, okay, severe scarring. Okay, severe scarring is possible. Unlike in the case of superficial partial thickness burns, where we're saying that there's no or minimal scarring, here there's going to be quite a lot of scarring. And because there is a lot of scarring, it means that contractures are possible. It is possible for someone with this type of burns to have contractures. Okay, it's very possible to have contractures. So why is it important to look out for that? Is because if someone has these partial thickness burns, okay, especially in the joint areas, in the areas where there are joints, for example, somewhere in the elbow, all right, what is going to happen is that if you do not take care of the patient well, and we are saying that contractures can form, it means that that patient may develop contractures and they will not be able to move their joint. Okay, movement at the joint is going to be restricted because of those contractures. So you have to be very, very careful. So let's look at the third degree burns and the fourth degree burns quickly. Okay, so third degree burns. So the third degree burns, what we see is that the skin is going to look whitish, dark brown, or dark brown. Okay, so you see we have white or dark brown and dry. The wounds are going to be looking whitish or dark brown, and they are going to be what? To be dry. Okay, why? It's because in this case, even the blood vessels have been what? Have been affected. Now, by the way, what we should know is that these ones are going up to subcutaneous. They're going up to the subcutaneous what? Tissue. So meaning that it's involving the epidermis, the entire dermis, and the subcutaneous tissue. Okay. Now here there is loss of sensation. Sorry. Okay. So here there is loss of sensation. All right. There is loss of sensation. Why? Because the nerve endings have been damaged by the burns. Okay. Then the fourth degree burns. Fourth degree burns, it involves all the skin structures. Okay, all skin structures up to muscle or bone. Okay, or bone. So all of them are involved, and then here we also say that there is also loss of what? Loss of sensation. Okay, so someone with third degree burns or fourth degree burns, they are going to have they are not going to have any sensation. They are not going to be feeling pain, because in this case as well, the nerve endings have been what? Damaged. Okay, so I wish I had pictures that I could show you, but especially because I'm recording the video and all, I cannot do that. But I'm sure when you go to the hospital, when you start doing your rotations, you're going to find patients and you'll be able to appreciate these clinical features that we are talking about. Okay, so let's look at pathophysiology. Okay, we're going to look at pathophysiology, and then I'm going to end the video after pathophysiology. Then I'll start another video for management. Okay. Now, in pathophysiology, we are going to have local and systemic changes. Those are the things that we're going to look at, all right? We're going to have local and systemic changes. So with local changes, okay, with local changes, what is going to happen really is that because of that injury, okay, due to whatever external agent is acting on the body, whether it is heat, whether it is a chemical or whatever it is, what is going to happen is that there's going to be coagulative necrosis of the epidermis and the underlying structures, depending on the intensity, right? So we should know that the severity actually of these burns really depends on, number one, how much of the external agent is actually acting on the skin. Okay, so if it's in terms of temperature, how much temperature? Okay, if let's say for example, if you have 100 degrees Celsius compared to let's say 200 degrees Celsius, someone who's exposed to 200 degrees Celsius, they're going to their burns are going to be more severe than someone exposed to 100 degrees Celsius temperature. Okay, again, the period of time, how much time has elapsed? So you find that someone is exposed to that agent for a short period of time, and another person exposed to that same agent for a longer period of time. So someone who's exposed to that agent for a longer period of time, they're going to sustain more severe burns. Okay. Then also, it also depends on the site. Okay, like we've already mentioned. Okay. So now we're saying that the external agent, okay, the external agent such as heat causes coagulative necrosis of the tissue, okay, and okay, of the tissue, depending on the amount of heat, okay, time of exposure, and what, and the specific source, okay, and the specific source of heat. So in this case, we're talking about thermal burns. Okay, so basically in terms of local changes, that's what we're going to have. Now, what we have is that the local changes actually, okay, in other words, the damage to the skin can be divided, or rather can be divided into what are called 3 zones. Okay, so the first zone is what is called the zone of necrosis. So let's say we have something like that. So if that is the area where much heat was applied, okay, then this is called the zone of coagulation, rather. Okay, this is a zone of coagulation. Okay, so that's where coagulative necrosis is taking place. And then the next zone is called the zone of stasis. We're going to have the zone of stasis, which is surrounding the zone of coagulation. Now, in the zone of stasis, what is happening is that here the vessels are actually there's vessel leakage and damage. Okay, so the blood vessels in this region, they are leaky and they are damaged. So they have been damaged and so they become leaky. Okay, and then lastly, we have what is called the zone of we have the last zone there, okay, which is called the zone of hyperemia. Okay, so this is the zone of hyperemia. So this is where you're going to, you just see that the skin is looking reddish, okay? So the zone of hyperemia. Okay, so in the zone of hyperemia, here there's inflammation, okay? There's going to be inflammation, all right? And other than that, there's also going to be vasodilatation, okay? There's also vasodilatation. Okay, so those are the zones. That's what is going to occur at the site of the burn. Okay, let's say if it's the skin, if this is the skin, the first zone that we're going to have, you have the first zone like that, which is the zone of coagulation, and then from there we have the zone of stasis. Okay, the zone of stasis continues like that. Then lastly, we are going to have the zone of hyperemia. Okay, maybe I should have used red in the zone of hyperemia. Okay, so I have the zone of hyperemia. So the skin around that region is going to look reddish. Okay, so that's what happens with the local changes. In terms of local changes, that is what is happening. Then let's look at systemic changes. Okay, so now what is going to happen here is that because of the burns, there are going to be some systemic changes, okay, as a result of some inflammatory mediators and so on and so forth. Okay, there are a number of things. For example, we can look at cardiac. So we're looking at systemic changes. So on the heart, rather cardiac, here there's going to be reduced cardiac output. Now the reason is simple. Okay, the reason is simple. Remember, when there is inflammation, there is the fluid in the intravascular space is going to go into the extravascular space, isn't it? Which is the interstitial space. So the more the fluid that is going out of the intravascular space, it means that the intravascular volume is going to decrease. And when the intravascular volume decreases, it means that cardiac output is going to be lowered. Okay, it is going to be lowered, and hence you're going to find that there's going to be things such as hypotension, right? Then pulmonary. So pulmonary here, there's going to be respiratory insufficiency. And this may also lead to respiratory failure, okay? Insufficiency, right? It may lead to respiratory failure. Now, the reason why this is happening is that, remember, there is inflammation and there are all these systemic inflammatory radiators, okay, that are going to be released. And once they are released, they're going to go into the respiratory tract, and then they're going to cause what? Vasodilatation, and also the vessels there, other than vasodilatation, there's also going to be movement of this intravascular fluid into the interstitial space, and that is going to cause the edema. There's going to be edema in the what? Respiratory tract. Okay. Other than that, there are also some of these chemicals that are going to be released that are going to also cause what? That are going to cause constriction of the muscles in the respiratory tract. Okay, so we're going to find that it's like there's going to be the lumen of the respiratory tract, let's say the trachea and so on, is going to reduce, and hence breathing is going to be difficult in that case because of the same. So there's going to be respiratory insufficiency, and this, if it is not corrected, it may lead to respiratory failure. Okay, then on the GIT here, there's going to be reduced, okay, reduced motility. Okay, there's going to be reduced motility, right? We can say reduced, or actually, if it is very severe, you can also have what? Absent motility. Okay, there can be absent motility where all the peristalsis, there's no peristalsis and whatever, and here someone may also present with features of intestinal obstruction. Okay, other than that, because of the stress, okay, remember we have what are called stress ulcers, right? So you can also have, someone can develop what are called stress ulcers, okay, which are called the Kelling's ulcers, ulcers, okay. So these are going to form, the Kelling's ulcers are going to form, okay. Then metabolic and immunologic, okay, metabolic. Here there's going to be increased metabolism, okay, there's increased metabolism, right? And then other than that, there's also increased oxygen and calorie requirement. So because there is this increased metabolism, it means that there is increased what? Oxygen and the calorie requirement, okay? And then there is also increased core body temperature. So remember, this metabolism, there's a lot of metabolism that is going on, and because of that, a lot of heat is being produced by the body. Hence, the core body temperature is what is going to increase. Okay. Then lastly, we look at the immunologic. Now, in terms of immunologic, what is going to happen here is there's going to be increased chances of what? Infection. Now, why is it so? It's because remember, the skin is the first line of defense. Okay, that is the first line of defense. Now, when there is that discontinuity in the integrity of the skin due to these burns, what is going to happen is that infections can go into the body through that discontinuity. Other than that, when these infections go into the body, what is going to happen? What happens is that because of the burns, there's some sort of inhibition. Okay, it's like there's inhibition or suppression of both humoral and cell-mediated what? Immunity. Okay, so there is suppression of humoral and cell-mediated immunity. Okay, so because of that, you lose that ability to fight against infection. Okay, so that is what is going to happen in the various systems that you have. Okay, now the other thing that can also happen, okay, although we're going to probably talk about it in the complications, is that you can also have AKI, which is acute kidney injury. Okay, we're going to talk about it under complications. Okay, so those that is about the pathophysiology. So we have local changes and the systematic changes. Local changes, we're basically looking at where the burn has occurred, and then systemic, what is happening in the various systems. So I'm going to end this video here, and then I'm going to start another one, which is the last part for the topic.